I've been dealing with uneven shoulders pretty well my entire life, ever since I can remember being even a kid. And I always thought that just pulling my shoulders back and down were going to be the quick fix. But really, when you understand the body a little bit more of the biomechanics, the fascia, how our body twists and needs to compensate for these issues, it's more than just the shoulder. So if you're just looking for shoulder corrective exercises, it's more complicated than that. But in this video, I'm going to make it really simple for you to just follow along with these fascia decompression techniques and these corrective exercises to start untwisting your body and to understand the root cause of your issue, why one shoulder is higher than the other, and actually make changes very quick. Because as soon as I started incorporating this, my changes happen really fast. And now if you are someone who is actively in the gym, weight training, wanting to gain muscle, gain strength, but you have these twists going on in your body, unfortunately, not just you, but I'm including myself in this, we're strengthening ourselves further out of alignment. What we're going to be doing is fascia decompression exercises to release these upper ribs and release the arm up here. Then we're going to work on rotating the pelvis back, engaging these core muscles more so on that left side while rotating the spine to the right. And then we're going to be working directly in that shoulder blade to help cement and strengthen it into that place. So let's just make this simple and split this up between the pelvis and then the shoulders and the rib cage. What really is happening, it starts with the pelvis. So your right hip here is likely hiked a little bit higher than the left. So we've lost that space between these low ribs and this part of the pelvis, and then what happens is there's a twist in the lower vertebrae to the right. Now see what happens as soon as I'm hiked up here and twisted to the left. Then what does my body have to do to compensate with that? Now it needs to rotate more so that thoracic spine to the left to help correct that and create more of that balance so that I'm still facing forward, or else I'll just be like this all the time. So now that we're here, now that shoulder is internally rotated, and you're gonna notice that what happens here, so this is the right shoulder blade, it will probably wing out a little bit too. You'll probably notice that there's more space between the spine and the shoulder blade on the right side compared to the left, because this is winged out and we're compressed in these right ribs. And then the left shoulder blade is actually gonna be more flush. But that's because these ribs are actually more compressed and it's anchoring back here. So what we need to do to correct this is work on the pelvis on bringing it back into balance by using our muscles and our fascia to correct this. And then we have to start engaging these left abdominal muscles and these left ribs to bring these in while we're starting to direct air consciously into these right upper ribs. So while we do these exercises, these are things that you want to become conscious of to really help unwind the body, because it's not just doing a couple corrective exercises, it's understanding the twist, directing the air, and then we have to start strengthening that shoulder blade, because we do have to obviously work in this shoulder blade and the shoulder as well to help anchor that into position. So that is what this video is going to cover. Let's get started with our fascia decompression exercises. Starting with our first fascia decompression position, we're going to be using a rolled up towel. So make sure that you compact it as much as you can like this, and just see what fits best for you. But this is what I prefer. It's very similar to our blocks we use in block therapy. And we're going to start off by opening up the ribs on the right upper side of our rib cage. While we're doing this, I'm going to be explaining the breathing. So first thing you're going to do is come down to your side ribs like this, rest your head in your hand. This is right in line with nipple height-ish. Again, it doesn't have to be exact. And we're going to start off by connecting to the breath here. So as you inhale, we want to be activating the diaphragm. That's extremely important. So as you start, feel it coming from the lower abdomen, and then expand that breath all the way into these upper side ribs. And what this is going to be doing is starting to unflare and decompress this rib cage. So let's settle in. The point here is to find pain, find adhesions, find compression, and stay there with the breath. So let's settle in here, top hand in front of you. As you inhale, feel it all the way traveling up to these upper ribs. And we are going to be searching towards the front of the chest as well, but we want to start releasing in here. Now, once you spent about a minute or so on the side, slowly shift towards the back and then start rotating towards the front. And then this is where you might feel more or less compression, but at every breath, be conscious of it so that you're inhaling all the way up to these right upper ribs. So try to inhale of 4 counts, exhale of 6 counts. If you can breathe in and out through the nose, that's awesome. You can also breathe in through the nose, out through the mouth, whichever you prefer. Now, once you spent about a minute or so here, you can come back, but we want to be spending a minimum of 3 minutes in this position to really allow the rib cage to decompress. And then when you're ready, we're going to be coming back to neutral, top hand in front of you, and then exhale up and off. So now that we just released this part of the rib cage, as I mentioned, the arm is directly affecting the shoulder joint as well. So if we are chronically internally rotated and we're at a computer all the time, we want to start releasing some areas in here. But what we're going to be doing is working right on the tricep area, which is going to be directly affecting the shoulder blade so that we can start creating a release to that shoulder blade and to the arm. So it's going to seem like a similar position, but a little bit higher up. And then we're placing the towel approximately mid-height in your upper arm, right on that tricep area. And then we're going to be starting off like this. And first of all, connect to that breath. And we're still wanting to expand that breath to these upper ribs. So as you inhale, feel it traveling all the way up. Expand those upper ribs, then exhale. And then you can slowly start to search. And if you work out a lot, you're going to have a ton of compression in this area. Remember what I mentioned. If you're working out a lot and we're already compressed and twisted, that's only going to build us further out of alignment and strengthening that twist. So we want to be able to release this. You can pull at times into the towel to create more of that pressure as we're creating this release, but then also allow times and moments to relax this tissue completely to really help melt these adhesions in this area. Once you spend a minimum of 3 minutes here, we're going to nice and slowly exhale up and off. These two positions are positions you're going to want to be focusing on daily to really help unlock this area. Even from me just demonstrating that, I already feel a release. But now what we want to do is start doing corrective exercises to untwist our body. So let's jump into it. This exercise, we're going to be focusing on untwisting our body the way we have collapsed. And remember, we got to start with that pelvis and getting used to where we need to position that before we start strengthening the thoracic spine in that opposite direction. So as I mentioned, we're hiked up here. We're likely twisting with the pelvis to the right, and then we're twisted to the left like this with our thoracic spine. So what we have to do is unwind this and start getting used to strengthening the body in that opposite way. So you may feel some cramping. It might feel really awkward. That's all completely normal. Just follow what I'm doing and these breathing exercises and techniques. So you'll want to be on a couch, a bench, a chair, whatever you have available, and make sure that your feet are flat on the floor and they're parallel to each other, because again, that directly influences the pelvis. Now, if we're twisted to the right, first thing we want to do is become conscious of twisting the pelvis. This might even feel a little foreign for you, but get used to doing this. Twist so that this part of the pelvis is coming back a little bit. And now these muscles here, we want to start to exhale, and in that exhalation, engage these muscles. So we're going to be engaging the obliques. Don't just try to crunch and feel the abs working, but really focus on this area. Now we want to keep this anchored to the left as we start to create rotations to the right. So you can even pull down with that left arm slightly to really engage these muscles like this. And then as we're doing this and pulling the pelvis back, we're going to extend the right arm to the side. Try to have the palm up towards the ceiling. Spread the fingers, because the hand and the finger also directly influence the shoulder. And very slowly bring your awareness to the thoracic spine. We're going to slowly exhale and rotate to the right. Now, this is where you might feel a little locked. You might feel cramping, and it might be uncomfortable. We're holding this for 5 breaths, because I see a lot of people just doing repetitions of this, and that's not going to persuade the muscles and the fascia to want to stay in that position. So exhale to the right, protract that shoulder blade. So don't shrug up, push the shoulder blade and the arm away from your body and your rib cage, and keep rotating. Now with every breath here, you want to try to exhale and rotate a little bit further without losing the connection down here. So you're pulling down as you are exhaling and rotating to the right, opening that palm, pushing the shoulder blade away. Inhale, direct the air all the way up to these upper right ribs. And then exhale, rotate a little bit more to that right. And you might feel that it's going to start to unlock or loosen up as you start doing this, but we're also releasing and strengthening simultaneously to really start persuading the spine to be in that correct exercise or into that correct alignment. And now, before we do anything with the shoulder blade, if we don't correct the spinal rotation, then we're strengthening that shoulder blade still out of alignment. So as soon as we start to create more of that symmetry in the spine, then shoulder exercises start to make sense. So once you've held that for 5 breaths, come back, relax, take a few breaths, and then repeat that 2 more times. So we want to be doing 3 sets of 5 breaths. If you can extend that to 10 breaths, that's even better. And then what we want to do is start working directly in that shoulder blade. So as I mentioned, the shoulder blade gets a little bit winged out. So we want to learn how to bring that shoulder and protract it and strengthen it. So you're going to need a band for this next exercise, and we're going to start strengthening this shoulder blade more so into that correct alignment. For this next exercise, we're going to be focusing directly in that shoulder blade and strengthening the shoulder blade protraction, but also that external rotation to really help cement that shoulder blade back to where it should be, rather than always being winged out. And if you've done scapular push-ups before or working directly in the serratus, that's going to help significantly as well. But I love this exercise. We can really isolate that one shoulder. All I have is a band here. Funny enough, I have it connected to a light post here. And all you need, you don't need a heavy resistance, especially for this exercise. But what we want to start by doing is protracting the shoulder blade. So again, it's as if you're pulling that shoulder blade kind of away from that spine and down into that protracted state. Take a step back. And then what we're doing is pulling back while externally rotating all at the same time. So what this will look like is exhale, connect those left ribs again, as I mentioned, with that left core, engage that, and then we're going to bring this back and externally rotate all at the same time. And you're gonna feel that a ton of muscles in the right upper back are gonna start firing up, and they've probably been dormant for a very long time. So let's exhale, hold this for an inhale to start isometrically strengthening this, and then exhale back down. Inhale, exhale, pull, externally rotate, hold this, inhale, exhale, and then come back down. So try performing 10 repetitions if you can. If you can do more, that's amazing. But it's all about the quality of these reps rather than just trying to do as much resistance or as many reps as you can. These are corrective exercises. We're not bodybuilding. We're not trying to gain muscle. We're trying to correct yourself so that next time you go to the gym or just go through daily life, you don't have those uneven shoulders, you're not in pain, and you're starting to truly align the body. To wrap up this video, this is the routine to follow, and yes, you can perform this daily. So we started with 3 to 5 minutes with that fascia decompression position in the right upper side ribs. Then we moved on to that tricep position. Spend 3 to 5 minutes in there as well to really allow the tissue to decompress and release. Now we're more ready to start strengthening the body where we've collapsed and rotated. So we anchored that left side, we rotated to the right, and we held that for 5, even up to 10 breaths. Do 3 sets on that side. And then we ended off with that band exercise, really cementing that shoulder blade more so into that correct alignment. And this is going to help you with those uneven shoulders. This is also a great time to start doing scapular protractions. I've shown those in other videos, and that's going to help level out and having your right and your left side of your shoulders working in conjunction with each other. So anyways, if you found this video helpful and you enjoyed the Greg demonstration, make sure you subscribe, like this video, leave any comments that you would like or any ideas for future videos. We'll see you in the next one.